the eastern Chinese city of Wenzhou has restricted the movement of residents and closed roads in the most drastic steps taken by authorities outside the epicenter of the deadly virus. Only one resident per household is allowed to go out every 2 days to buy necessities. Authorities said in the city of 9 million, while 46 highway toll stations have been closed. And Zhejiang province has the highest number of confirmed cases outside central Hebei province at 661 confirmed infections, with 265 of those in Wenzhou. The city, which is more than 800 kilometers away by road from Wuhan, the epicenter, has also cancelled public events and closed public places like swimming pools, cinemas, and museums. Wenzhou's metro line and public transport have also been suspended, as have inter-province buses.
Well, now joining us to speak on the coronavirus and what Nigerians need to do to stay safe is Dr. Misbah Oleolo, consultant physician and medical director at Reddington Hospital. Thank you so much for joining us, sir. Welcome to the morning.
Good morning.
Show. Now, this is a serious epidemic. The World Health Organization has declared it an emergency. First of all, can you tell our audience what you know about the coronavirus?
Thank you. So the coronavirus there are a group of viruses, but the particular one that's causing this infection is the 2019 novel coronavirus. The previous coronaviruses that we've come across in massive outbreaks of this sort have been the Middle Eastern Respiratory Syndrome virus and the SARS virus. So this is not something that's completely unheard of. Right. However, what's different with this is that it's an infectious disease which usually manifests with respiratory problems, which means people have symptoms usually either mild, like the common cold, or in extreme cases, it goes down to the chest and causes problems. Okay. In terms of what people may experience, like I said, it may be no more than a common cold, but in extreme cases, they may have, or in worst cases, they may have a fever, a cough, chest tightness, and that chest tightness may be so bad that them getting oxygen to their system becomes a problem, which can then affect other systems and cause organ damage, which is often where the fatalities result.
I think that might just be where the problem is, being able to, decipher between just a normal, regular cold and, an illness or an ailment as serious as coronavirus. But tell us exactly why it is so virulent. Why is it so aggressive?
So that there are two components to it. There are host factors, of course, because as you can see, there have been people who have had the virus who have not, obviously, it's not resulted in fatalities in those individuals. So that's a host factor. How much of a defense can they mount against the infection? But then there are also the infective agents factors. So, for example, the inoculator, the infective dose that the patient receives, how good their background immunity, whether they might have a pre-existing medical problem, for example, if they've got diabetes, if they've got ongoing respiratory problems anyway, if they've got a weak heart, or if they've got kidney disease, or if they've got a compromised immunity. That gives the virus a predominance at that stage. The inoculating dose, so for example, somebody who gets as we know, sneezing, for example, is one of the routes by which it could be spread. So if you sneeze once, obviously the dose is less than if you sit in a room where someone's sneezing repeatedly on you and you're coming into contact with their body fluids. The amount of the virus you then take on becomes quite significant. So there are quite a number of things to consider in deciding how each individual responds
or manifests
their clinical.
Okay, we'll take a short break at this point, and when we come back, we will get to learn a whole lot more about the nCoV. That's the name that's been called now. Stay with us. We'll return shortly.
Welcome back to the morning show on Arise News. We are still joined by Dr. Misbah Oleolo, consultant physician and medical director at Reddington Hospital. Now, Dr. Oleolo, we are discussing the coronavirus and the symptoms of it. And prior to going on the break, we had sort of covered the symptoms, but we haven't really dissected what it looks like. Can you explain that to us?
Okay, so it's important to understand that the symptoms could be mild, which means people can have a bit of a nasal congestion, a bit of an itchy throat, a runny nose, or a sore throat. They may also have a temperature. However, the more severe symptoms tend to be a severe cough, a really troublesome cough, some chest tightness, difficulty breathing, and in some cases they may just be obtunded, which means their level of consciousness may worsen because the level of the oxygen they're able to get into their system is reducing progressively from the fact that their lungs are very badly affected. So the point I'm trying to make is that it could be as mild as what you may consider a common cold, or it could be really severe. The important thing to note, especially for the patient, is to try and gauge what one's risk is. So for example, if your job is at the airport and you might have been meeting people who've been flying into the country, your risk profile is slightly different from somebody who lives or who works, say, for example, in an administrative job in a ministry who doesn't come into contact with a lot of travelers. If you're a business person and you've been doing a lot of international travel, your risk is obviously higher, and therefore you can't just assume that your temperature is malaria or is typhoid, as we're keen to do in this environment, or assume that a cold that's slow to clear is just a common cold. You have to take into cognizance the fact that your travels or the nature of your job might have exposed you. So it's not just the symptoms that we need to look at. We need to look at something slightly bigger, which is
total holistic
what's the added risk that you carry?
Okay, so what sort of vigilance method should we adopt in Nigeria?
So I think the federal and state governments have certainly helped us. I think the first step is, like the Minister for Health has quite clearly stated, all travel to China now should be suspended unless it is absolutely essential. Unless it is absolutely essential, I think. That has to be pretty clear. Now, for people who are coming in from China, the advice from the liaison between the federal government and the Chinese embassy is that people should self-quarantine or self-restrict for about 2 weeks. From the perspective of the individual or the airlines, we need to bear in mind that if you suddenly have someone who's boarded a plane and who's sneezing, coughing, and spluttering, then the airline should really be reporting that to airport health.
What does one do in that case if you are a passenger on that plane?
Very interesting question. Yeah. I think in a situation like this, the airlines have a lot of responsibility to make sure that people on that flight, especially those in the immediate vicinity of the person concerned, are probably, there's some sort of contact tracing to ensure that even though they've only been exposed for a very short period, going forwards, should they develop symptoms, their level of vigilance and suspicion is higher.
Okay. Now, the World Health Organization has declared Nigeria among the 13 high-risk countries, and, you know, at the same time declared it a public health emergency of international concern. Exactly what does that mean, and how does that factor in, you know, when you're looking at Nigeria and our preparedness or lack of it?
Well, I think the first thing so why has the World Health Organization placed us on that list? It's our contact with China. There are somewhere in the region of 120,000 people, or
in Nigeria,
migrants from China, people who come in a year. So it's quite a significant movement between the two countries. So what does that mean for us in terms of our preparedness? I think we have to commend the federal and state governments for being ahead of the game, because let's bear in mind the fact that actually there are no confirmed cases in Nigeria. But the public awareness a lot of public awareness has been raised. We know that there's been a lot of liaison with the Chinese embassy. We know that the infectious diseases experts are on alert. The ports of entry are all on standby for potential cases.
But can you really say that there's enough public enlightenment right now? I mean, if you asked the average Nigerian on the streets of Lagos, for example, how much do they really know about coronavirus?
I agree that the level of awareness is not that great, but that's one of the reasons why we're doing this.
Right.
The whole purpose is to raise the awareness amongst people, enough for people to know, oh, wow, you've been in China recently, you've been in Turkey recently, you've been in the Philippines recently,
Right.
you are coughing and spluttering. Okay, they've done a malaria blood test, it is negative. We need to be thinking about other things. Do you want to go to a hospital to get checked?
Right.
So the whole idea is to raise the awareness by all the means possible, so that as a population, our vigilance is increased and we're able to take adequate precautionary measures and send potential cases to the infectious disease experts.
Now, we're talking about travel. The U.S. has imposed some sort of ban or restriction. Also in Australia, they've imposed that. How effective is that type of restriction? Or is it something that should be of concern to Nigeria to sort of restrict or have some sort of travel ban for Chinese people coming into Nigeria?
So let's not look at it from the perspective of travel ban. Let's look at it first from, so the Foreign and Commonwealth Office have what they call a travel advisory.
Yeah.
And I look at this as a travel advisory spectrum. So there is a range of activities or a range of pieces of advice that you can give. Do not go to China if you don't have essential business there. When you're coming back from China, this is what you should do. However, once you've got a number of confirmed cases, you now have the problem with you, and you can then see why those governments will take that step. But if I could use the current World Health Organization advice about Ebola as an example, the concern I have about a travel ban is the fact that if you have a travel ban in Australia, so Australia says Chinese migrants or travelers from China can't come in, they could fly to New Zealand and fly into China that way. And
Right.
you lose the opportunity to then monitor who's coming from where. So that's where I think there are problems. If there isn't a coordinated or an international decision, for example, from the World Health Organization, saying specifically ban incoming passengers from particular countries, I think there is a problem in the sense that people can get around whatever bans there are.
Which
That's
will prevent
interesting.
screening and all of that.
It's
Yeah,
interesting
which
that you mentioned
Yeah.
Ebola, because currently we are at double the level of Ebola cases that they were back in 2003. But what we do know about Ebola now is that it is a heat virus. It is, contracted via animals, but also spread through heat. Being that we are on the continent and we live in Africa, of course, we are subjected to heat every day. There are a lot of people that do not have symptoms, but still are casualties of coronavirus. So what is the prognosis between infection and fatalities? And also, what can one do if you're asymptomatic to coronavirus?
Okay, so the first thing is that in terms of the case fatality, the last time I checked from evidence that the Chinese authorities have put out there, it's about 1 in 50. So if you've got 50 people who've got the confirmed cases, probably one will die. That's the
And with
data.
11 million people in Wuhan, it's a large number.
It's a large number. So we know that about 2% of who have the disease will die. Now, given that sort of scenario, if you've got mild symptoms, it is very unlikely that you'll fall into the fatal group. It's often people who have the very severe symptoms or who have a compromised immunity. So someone with diabetes, for example, who's got mild symptoms can rapidly progress to fatality because their immunity is compromised.
low.
So you always have to look at the person and their disease together rather than just the symptoms. So for that reason, I would therefore categorize people into people have compromised immunity and therefore at risk to rapidly progress. And my advice to people like that would be, you've got a temperature that's not settling, you've had malaria tests that are not positive, there's no obvious cause for your temperature, or there's no obvious cause for your runny nose, and you fall into the group of people who travel quite a bit, then you need to be a little bit more careful and report somewhere where you can be
Is there any hope at
tested.
all? Because I read somewhere that an Australian lab has been able to isolate the virus. And back here in Africa, there are only 2 labs where you can actually test and be able to ascertain definitely that this is coronavirus or something else. How does that look for us?
I think the issue here is having the infrastructure in place to isolate probable and suspected cases fairly rapidly, and being able to escalate their treatment needs fairly rapidly, and making sure that the public health system is so fine-tuned that just like we got the Ebola right, should there be any confirmed cases, we can rapidly nip it in the bud. That's what I feel. I don't think the problem is so much whether we can diagnose 2 or 3 or 4 cases. Okay. I think what we're trying to prevent here is having 20, 200 or 2,000 cases. I think for us, prevention is really the issue, rather than trying to do the finesse of diagnosing the problem.
Okay, well, hopefully with the 71 million naira or so that government has earmarked, to help support the fight against coronavirus, we hope that can go a long way.
Right. Well, for the benefit of our viewers, just in case people don't know, what are the infectious disease centers that we have here in either Lagos or wherever else in Nigeria?
So definitely I'm aware of an infectious diseases hospital in Yaba.
Okay.
I think what is likely to happen with the ongoing work in government circles is that they're probably going to expand their capacity to absorb suspected or probable cases, such that access is not just at one point, but at several points. I don't have the details of that, but I suspect that's what's probably going to happen in the near future.
Well, thank you so much for educating us on this virus, and we hope that it gets contained.
Indeed.
Soon. Oh, yes. And of course, the public enlightenment continues, and right here at Arise News will be, staying on it to see how things develop.